All right, you're on there. Hello. Let me confirm that we are not sideways again. Michael's had a nice 15-minute rest. Let's see. I mean, for me, it's showing as correct. I'm going to check over here. It's correct. Okay, yeah, I think so. Sorry, guys. I'm checking because I see that you were commenting through Patreon, so I have to go back and forth between Patreon and YouTube, so I'm just making sure that you're still with me, and thank you, and I don't know what just happened there. I've never had that happen. Did you just do a thumbs up?
I did.
Okay, so we're just slight delay. We're good. Okay. Thank you guys for being patient. We're there. So we left off positioning the body in constructive rest. And hopefully you guys have, pardon? Yeah. So we have your head, remember, so if your chin is towards the chest, you want to take something out from under you. So we don't want that pillow head. This is head forward, right? We don't want to do somatics with head forward. We want neutral neck position. The other side is when you come down, the sign usually, if your upper shoulders are lifted off the floor and you're tighter through your pectoral region, then typically that's when we see the head back like this. And that's when we'd want to put something underneath the head to bring the neck in a neutral position like Michael's. So now we're doing the belly breathing. And that is just a way to ground yourself through your low back. We're working on low back today. So you with or without your hands, absolutely, you can let your hands stay there. So we're focusing on the exhalation and allowing the low back to almost melt into the ground. And this is a really important part of healing the body, specifically low back injuries, because if I recall, when you did it, you had some not so kind words to say about yourself and to yourself, to your back. And so part of that healing comes in what we say to ourselves. And the breathing is a really nice way to invite your body to relax and release. So to give it the benefit of the doubt that it wants to heal as much as you want it to heal. So breathing and sending light and love into your back. Feels okay?
Okay.
Remember when you're doing your breathing that you're going to find your rhythm to your breath. And what we do is we do breath ratios. And a breath ratio is if you count your inhalation, see how long that is. And then also count your exhalation and see how long that is. And what you can do is when we do equal ratio, it's just that. So maybe it's a 3 or 4 count inhale or a 3 or 4 count exhale. But when we're trying to relax more and heal, then we do a longer exhalation to the belly. So the most healing breath we can do is breathing to the abdomen, so space-wise, and focusing on exhalation and making that a little bit longer. And know that things happen in all of the systems of our body, so the inhalation is more connected to your sympathetic, your what we say is fight or flight, but it's that go. It actually increases your heart rate slightly. The exhalation is related to your parasympathetic, your relaxation response, or it also drops your heart rate slightly. Your heart rate slows. So going more into that exhalation. Okay, good. We're going to start with some very basic pelvic tilting. He's been doing this all week, so I know it's comfortable for him, but it's always a good place to start because pelvic tilting is taking your low back through an arch and curl or extension and flexion. So I'm going to have you start to inhale, come slightly onto the tailbone, and exhale, press low back, low ribs into the ground. Yeah. Inhaling. And for me, working in yoga therapy too, I use this as an assessment. I'm watching his pelvis first, making sure we're not overdoing. So you can check yourself. Even go a little bit slower, a little bit softer. Remember, that's the key with these movements. And then asking yourself these questions as I'm going to ask him. Do you feel anything tightening in your legs?
No.
Okay, so you want to keep your legs relaxed, feet softly on the floor. Reminder that when you need more grounding, you can come into your feet, just feeling your feet touching the earth. But it's the belly lifting the low back on the inhale and then releasing. And what we're doing in this posture, this movement, is on the inhalation, the abdomen expands and the low back slightly tightens, which actually makes space in the front of the discs of the spine. As you exhale, the abdominal muscles are contracting, which gives the low back more permission to relax all the muscles in the low back because it feels the abdominal muscles holding you. So the other thing we look to assess as he's doing this pelvic tilt, I checked from the feet up, is first that the legs are relaxed, that all of this tight energy or this I call it, well, the grumpiness, right? Sometimes I say the grumpiness isn't going into the legs. But the other thing is this is a tail to tongue movement. So I'm watching his head as he's doing this and his neck. We don't have a lot of movement in the head and neck, but there is some. And then what we should see and what you can feel in your own body. So this is very telling for the shape of your spine as a whole, this movement. As you inhale and you go onto your tailbone or your low back arches, your chin should come slightly towards your chest, naturally. You're not making it do it. And then as you exhale and low back goes into the floor, the chin comes slightly away from the chest. So that's why it was so important to prop the head in that neutral position, so that it has the ability to go through this range of motion forward on the inhale and back on the exhale.
Yeah, it feels really good.
Yeah, and you can, if you're not finding that, you can just slightly think of, I'll sometimes open my eyes when my back is really locked up, and on the inhalation, pressing the tailbone down, what you can do is take your gaze slightly towards your nose. Don't overdo it, but take your gaze a little bit more towards your chest and your nose so that your chin comes towards your chest. And then as you exhale, take your gaze slightly back behind you. Yeah. So this is, like I said, it's a tool of assessment for yourself as well as a wonderful movement to relax and release the whole length of the back and spine. And then let's stop for a moment, and then we give the body a chance to respond. So maybe your shoulders want to roll. You might want to rock your legs side to side, draw your legs into your body. You can take your neck in gentle circles. So see how your body responds to that movement, because once we move fluidly from the spine, the rest of the body is resituating itself. It wants to resituate itself. So let it do that, whatever comes naturally to you. Nice. And then I'm going to have him take his feet back onto the floor, so please take your feet back down. So the next one we do, I happen to know that a lot of his tightness, so we get the gripper muscles. Your muscles will lock in after any sort of back injury, and it can take, it's been a week and they're still tight. So we want to release those muscles. And I happen to know his are right around his sacrum. So the lumbar spine is going to be up here. Your sacrum is the triangular bone that starts right at the top of your butt crack. And then you have your PSIS points out to the side here. So think of that triangular bone. So we want to stretch the muscles on the side of that bone. So we're in constructive rest again. And feel the big toe side of your foot, of your right foot. We'll start with the right foot. And as you breathe in, you're going to come on to, I'm sorry, first widen your feet to the edges of the mat, all the way out to the edges. This one, too. There you go. And then feel your big toe side of your foot. And as you breathe in, you're going to bring your right knee forward and inward, but this left knee is not going to move. It's going to stay where it is. And then come back. So really small, slow motions. Move that over. How's that feel?
Feels good.
So one of the things we did a little test before we came on camera, apparently not enough testing, but we tried, is when he first started to do this movement, would you show them what you were doing before I stopped you? So both legs were dropping towards me. So the left leg was dropping open too. And then when I held his knee, his left knee, and had him just move his right leg, describe the difference in the feeling there for me, will you?
It's much more internal thigh engagement and
Yep.
less outer, I guess.
Okay. So what he said was more internal thigh engagement. So he's using his adductor muscles to bring this leg forward, which anytime we use, yeah, you're getting more of a stretch there though. Well, anytime you use one area of muscle, something else is going to feel tension, and tension is stretching, right? So we're trying to stretch this side. So if we can engage the inner thigh, we're going to get more stretch in the outer hip and thigh. And that's what we're looking for right now. And you also feel longer waist versus letting both windshield wipers in yoga, we let both legs fall. We're moving on just this right side. The other reason I do this is it's, again, an assessment for me, because we may find that there's a lot more sensitivity on one side than the other, right? And I can't remember for you. Well, we'll see. We'll compare.
On this side.
Yeah. So you'll be able to compare in yourself. And the other thing I'd ask him to do, and you can do this too, is moving from different places. So this is more about proprioception, because when your back gets locked up, it's all of what we call the diaphragms of your body, including your feet. So I want you to do the same movement, but initiate it from your feet. Think of rolling onto the big toe side of your foot into the arch of your foot. And then when you come out, roll onto the pinky toe side.
It's really a lot different on the thigh.
Yeah, different on the thigh and the muscles we use. So initiating from the feet, all of this is about waking up and then ultimately changing muscle patterns, right? We get locked into certain patterns. And in the case of when we hurt our back, those muscle patterns that we're locked into are not where we want to be. There's muscles that are tight that won't let go. That's it. So that feels different with your foot. Now you can go back to moving from your hip again. But we're going to add a little bit more. So to get a little bit more side, but if you're having any, there's joyful discomfort and there's pain. Joyful discomfort I'm good with, but if you're having pain, we wouldn't do this. But otherwise, as you're inhaling, what you can do is take your right arm and reach it up overhead, creating that space through the side body. So a lot of times back injury will actually, you'll tighten that whole side. Your shoulder will tighten, your trapezius muscles in your upper back, side body, all of that.
It's
so we're
definitely a progression as the healing happens too.
Yeah.
Seems like.
So just stretching that whole right side. There you go. He's been doing one breath per movement, but you could always stop and hold or take it slower. Take a couple breaths to find your end point in the tension point. So this is the tension point. Tension is stretching. And you'll know because your skin, you'll feel your skin stretching, right? We say the word stretching, it's tension for the body. You're placing tension on the muscles, on the tissues, and then you're releasing that tension. So think of it that way. Tension in the form of stretching, and then completely releasing that tension. Yeah. Let's do 2 more on this side with the option to stop if you're at home and you'd rather stop and hold. So this gives you an opportunity to explore the 2 sides of the body, because oftentimes in back injury, one side would be more affected than the other. Nice. The other thing I'm going to note that I'm watching here is his head again. And you may not have noticed it, but as you started to go deeper into the movement, the head started to naturally roll and respond. Did you see that? Mm-hmm. There you go. And the head might roll towards the right shoulder or away. But the point is to let the head respond. Let the head move too. The head feels the pelvis moving. It says, I want some of that. Yeah. All right. So then come back to the center. Take a moment. Just feel yourself through both feet and both legs, both side bodies, because that was all the way through your torso, right? Yeah. And just notice the 2 sides if there's any difference in the 2 sides. Pause. You can go back to your belly. So more relaxed. Does one side feel different than the other?
The right's more relaxed.
The right is more relaxed than the left. Does it feel longer, shorter, tighter, looser? Longer. So use these descriptive words for yourself. When I'm working with somebody one-on-one, I really push them not to say it's better, it's worse, it's okay. I want you to use descriptive words in your body. Like if you were writing a lovely novel for yourself about what your body feels like, describe your right side. Let your right side describe to your left side what it feels like, and your left side's listening. And your left side's like, I want some of that, right? So we'll switch sides. So the right knee's going to stay where it is. Make sure your feet are slightly wider than your hips. Just sensing the big toe side of the left leg. Inhale, reach that thigh bone. So think of nice, big, strong femur bone. Reach it forward and inward. And exhaling and coming back. Nice. So we want to keep the pelvis still from here. That knee's going to stay still. There you go. So it's not just this this is 2 movements for the pelvis. There's a slight rotation of the left hip. You're feeling the hip lift. But there's also a reaching, a lengthening. So this is 2 movements in one, a lengthening of the hip and a slight rotation.
And I feel that much more in my sacrum than the other side, and this is
okay. So you're feeling more stretching. So I'm not sure if you're hearing what he's saying. He said he's feeling a lot more in his sacrum on this side. So those are the muscles that were those gripper muscles that sort of froze. Joyful discomfort, good. And you will know too, because if you can do the movements consistently to your breath, then your nervous system isn't trying to respond by locking up. But if you find that your breath gets stuck, that means your body's getting stuck somewhere. So we're moving from the thigh right now. I'm just noticing what that feels like. And what I can see is a little bit less range of motion on this side than the first side, so that goes right along with what he's saying, that this side feels tighter. And now I'm going to have you do the same motion at home as well, but you're going to think of initiating the movement from the big toe side of your left foot. So come onto the arch, push the arch of the foot, the big toe, into the ground. Let that pinky toe side lift on inhale, and then come back onto that pinky toe side, press it down, come back all the way to neutral, right? Does it feel different moving from your foot? Yeah. So these are different ways to wake up your nervous system. Remember, your nervous system is two parts, sensory and motor. So this is the sensory part. You're sensing your foot on the ground.
This is more of the love letter to my femur.
Make sure you heard that one. He said this is a love letter to his femur.
I don't feel it so much in my back this way.
Interesting. Okay.
When I initiate from my foot.
Okay. As opposed to initiating from the pelvis. So the pelvis is bringing more sensation into his back. This is not. So it's a little more easeful to move from the foot and the ankle, which recognize when we are standing and walking, it's the feet that are the first responders that are feeding all this information to the brain of what muscles should turn on, what can relax, right? So feet are really important. All your proprioceptors are in your feet and your ankles, most of them. So let's add, you can let that one come in. Let's add the arm. So if it feels like it's too much, just don't go as far. I'm going to get out of the way here though. So you're going to inhale. As you inhale, take the left knee forward and the left arm overhead. So nice big arch in the side body and a lengthening. So arching that left side body and lengthening. The other thing is we were doing the belly breath in the beginning. Think about breathing a little bit more into your torso. I didn't say that on the first side, but remember the breath creates space, right? And you have this opportunity as you're breathing to create space through your left lung, your left ribs. Feel even, so those intercostal muscles between your ribs can tighten up. Nice. My mat's probably getting in your way, right? Inhaling and lengthening, nice. And even as you're adding the arm, one of the things I do, just like we moved from the hip and the thigh and then we moved from the foot, these are all little things we play with, because as soon as things become easy, you check out, right? And then you're like, why am I even doing this video? I could go be in my garden. There's all these things that come into mind. So change something just a little bit. So what I would ask you to do is, as you're lengthening your arm, think of trying to bring your arm overhead from your ribs. And how's that feel? Versus reaching your arm. Can you bring your arm overhead by bringing your ribs towards the back of the mat? So these are all ways, and I do this with the organs too. What if you move from your spleen? The right side we can move from our liver. Here we can move from our spleen. If nothing else, it's a lovely way to acknowledge these super important organs in our body, right?
Good morning, spleen.
Good morning, spleen, exactly. All right, we'll do one more there. And then coming back. So I started, because his discomfort is in the back, we started in the back. Because part of it was assessment, but the other reason is if I have somebody lay down like this and you don't let them move the painful part, a lot of times it's going to stay in pain. So all of that was done in an effort to relax your back more. So notice how you feel. You go back to your belly breathing. So now we're going to get a little bit more into the feet, ankles, and knees, into the leg line, because as above, so below. So when things start to lock up around the pelvis, they usually lock up below too. So with Michael, he does not have a strap, so we had to pull it. But see, this is what you can do from home. We had to pull the belt off of a robe, but that works. But what we don't want to do is we don't want to strain the back. We want to keep that low back. So notice the position of your back right now. That shouldn't change. But I'm going to put the strap around the right thigh. So if you're using a strap, please put it around your right thigh. You want your shoulders to stay relaxed. So the other thing I'll see is the shoulders will come like this to hold the strap. Keep the shoulders relaxed in the neck. And I want you to lift your leg line just enough, lift your foot up and take your foot towards the sky. So you're using this to hold your leg. Yep. And start with your leg lower and just squeeze and release your toes. Just the toes. Squeeze and release just the toes. Squeeze him and release. So I'm having him keep his leg lower. I could even have him keep it on the floor and do this. If you want more sensation, then begin to extend the leg more. So what you're noticing as you're doing this perhaps is it's not just your toes moving independently. You're going to feel muscles in your shin, your calf, your thigh. So now let's go the other way. I want you to spread your toes and pull them back towards my hand and then release. But not the ankle, just the toes. So, yeah.
Feel that all the way up here.
All the way up to the hip. So everything is interconnected, right? Just moving the toes, huge, huge, huge for back pain. It's like, and it's a distraction too. All right, and then see if you can wiggle just your big toe. Move just your big toe. I found it really interesting when I was in the hospital last week. They were checking nervous system on my mom, and one of the things the doctor asked her to do was take her big toe in circles. Some of you guys know I have you do that all the time.
I can't do any of that.
Can't do it.
I don't have
It
talented
happens.
toes. I don't have
All right.
independence in my toes.
So you can let it rest for a moment. So now we're going to go into your ankle. I happen to know his ankle mobility is a little bit limited. So we're going to start you low again, but you're going to hold the weight of your thigh, right? So your low back is still relaxed. So the idea is the low back is on holiday. So now you're going to inhale, reach the top of the foot away from you. So you're going to feel stretch through the shin. Your calf is going to tighten. And then exhale and release that. Release. See, you're pulling back. I just want you to release. Inhale, reach forward. Imagine pressing on a gas pedal. And then exhale, release. That's it.
Something I don't have to imagine.
So calf tightening and shin stretching, and then back to that point of neutral. So if this is feeling good and you're at home and you want more sensation, extend the leg a little bit higher. Now go ahead and do that again. Top of the foot reaching. Feel all that length through the front of the shin. And then exhale, relax. You're trying to pull it back. Just relax it. All right. Now let's go the other way. So you can inhale, draw the top of the foot towards the shin. Now we're stretching the calf, tightening the shin. Exhale, release. Nice. So you could have your leg, the straighter your leg goes, the more sensation you're going to feel. You can also do this with the leg drop down more. You can do it with your foot on the ground. You can do these in a chair very easily. But notice beyond your foot what muscles you're feeling. Do you feel it all the way to the knee, to the hip? I'm going to stop holding your leg for you. All right, you get those. So that's just flexion extension. And then we'll take it in circles because that'll bring in the inversion, eversion. So taking up one more time. And this is where sometimes I'll come in and help. So go ahead and make what feels like a full circle for your ankle. Go even slower. Imagine drawing smiley faces with your ankle. There. See how much further you just went? That's it. Full range of motion. And you're doing the same at home. Pick one direction first.
My ankle's not making a smile like this.
He said his ankle's not making a smiley face. Switch directions there, you just did. Go the opposite direction. Keep
That ankle is so slow.
Keep making a pack with it. Find your range of mobility. Right ankle. So now you're moving. One of the things I'm noting is his whole leg is starting to move. We can absolutely move our ankle from our leg, but you want to keep the leg still. Move your ankle from your ankle. Do you feel the difference? Now go back the other direction. So these, again, are things that I see happen. People will think they're moving the ankles, and it's really easy to move your ankle from your thigh. Yeah, just like that. Thank you. Did you see that? So you're moving your ankle from your ankle, so we're really isolating these muscles. All right, go ahead and drop down and rest for a moment. Notice always coming back. So in this case, this is low back, right? So coming back, is your low back still relaxed? Do you feel like you need to get off of it? You okay?
Yeah, it feels all right.
All right, so then we're going to go into the right knee. So now you will definitely want that strap around the back of the thigh, and you want it on the meaty part of your hamstring, so not behind the knee. So when we go to do this one, what's really important is that you line up the top of the kneecap. So we don't want to come back here, which I often see. Top of the kneecap right over the front of the hip joint, or think your thigh bone is 90 degrees from your spine. So now, keeping the ankle relaxed and the toes, think of initiating from your knee. As you inhale, you're going to reach all the way up. That's it. So quadriceps engaged, hamstring stretching, exhaling, coming back down. Keep the shoulders relaxed. There you go. He's got a little noise going on there. I'll bring the camera in, so the mic in, so you can hear it.
That's been there for quite some time.
But mindfully moving, knee joints, right? Simple movement, flexion, extension.
There's no sneaking up on you. My knee will give me a
couple scars from knee surgery there, so that tells me a lot.
But it goes every time that way.
There you go. So now you're feeling that balance between front and back of the thigh muscles, quadriceps and hamstrings, right? And just sensing that, feeling it all the way into the hip. So super, we call this a gentle joint series sometimes, or it's my body prayer in the morning. So what you say to yourself, really important. So if you want the next one, take it into a hold for a moment, take it to your end point, and now try again moving your toes and your ankle and see what that feels like. It kind of lights up all the muscles in your leg line, right? You can feel, you know, that leg is extended and already active, and then when you move your toes and your ankle, it's going to add a little bit more pizzazz. All right, let's take that strap off. How are you guys doing? Are you still with me? I'll take that off. All right. Note your two sides. This is always that moment where you check in with yourself, that your brain, and if you need movement in between, hugging your knees in or windshield wipers, this is intuitive side kicks in, right? You might need something in between. And then stopping at a point of stillness just long enough to compare. And I think that's really important, even if you just take 10 breaths. Stopping, feet on the floor though, relaxed and released. So back to your starting point, whatever your starting point was, which was constructive rest. This is your landing pad. And just noticing right and left. Is there any difference? And if your landing pad was, your starting point was your legs extended, then you can go ahead and do that, absolutely. But coming back, is there a difference between right leg line and left leg line?
This feels like it's 2 inches longer.
You said his right leg feels 2 inches longer. So for yourself, if you were with me right now, I'd ask you, use very descriptive words. Is there, and sometimes there's not a difference, and then that's our experience too, and that's okay. But just noticing what you feel on the two sides of your body. Because you are the only one that can do that. Go into your skin. Go inside of the skin, what's going on there. Okay, so then we're going to do all that on the left leg, which we happen to know that was his grumpy side, right? And you may know if you have one grumpy side now. So don't expect, well, let's just say don't expect. That's all we'll say. The best expectations are no expectations. So we're going to do the ankle first. You can lift your leg up just enough, maybe to 90 degrees. I'm sorry, do the toes first. You're going to squeeze the toes. I like to do that on an inhale and then release on exhale. That's it. Just the toes, squeezing and releasing. Squeeze them as tight as you can. Imagine trying to hold a pencil with your toes. A couple of these guys aren't really moving there. Squeeze it. There you go. And that's what I'll...
I forgot to do my piano toe exercise.
Yes, piano toe keys. Piano key toes are really important. Squeezing and releasing. Is it aggravating or? Okay.
My back of my thigh was getting really tight.
Okay, but that's interesting. That's when we say interesting, right? Moving your toes is making your thigh tight, although it might have been the lifting too. So if you'd rather keep your foot on, let's try this one with foot on the floor for him. So you're going to go just the opposite now, though. You're going to pull the toes towards the top of your foot, but keep the ball mount down. So he's just lifting his toes off the ground and then releasing. And for you with your back on this side, that might be better than lifting the leg up. Yeah. So we have to accommodate, right? We might have to do the two sides differently. If you don't have pain, you can extend that leg and do these toe movements. So you might be left leg somewhere pulling your body. All right. Toes awake. See if you can move just your big toe, because that's waking up your nervous system. moving just that big toe.
What reason would I have for just moving my toe?
It's the furthest spot from your brain.
Yeah, but they always go in concert.
They don't always go in concert, because then that concert gets stuck and you're hearing the same song. It's like playing the same song on replay over and over and over. That's muscle memory, the same song over and over and over. You want a whole concert.
Well, and that's good if it's the right muscle memory, right?
No,
No.
not if you ask me. All right, lift up. Most people don't have good habits. Okay, so now we're going to go into the ankle. So is that, if this doesn't work, we can try it with the leg
That's
down.
okay right
So you're
now.
going to inhale top of the foot away from the shin. So you're reaching the ball like you're stepping on the gas pedal. And then exhale, release. Just release.
I just got to go easier too.
Yeah, really easy. Inhale, top of the foot. Exhale, release. You guys at home, just the left ankle. Reach as far as you can. Imagine stepping on a bike pedal. And then just release. And you can keep the knee bent, or you can extend the leg upward. Let's go the opposite way. So now you're going to inhale, draw the top of the foot towards the shin. So now you're going to stretch that calf muscle, which often they're tight. And you're shortening the muscles in the front of in your shin. There you go. Keep the toes relaxed and move from the ankle. Too much? Low back?
No, I'm just getting a cramp in my hip.
Okay. But that's all important stuff to note, because we didn't have that on the first side. So what I would say to you, if you ever have this where there's more discomfort in one side than the other, whenever you can, spend more time on the side with the discomfort. So you might kind of whiz through the first side just for a comparison, and then do the grumpy side a little bit longer. Give it a little more TLC and stop in between. So we did the 2 ankle motions. We went forward and back. Feel okay? And then we do the circles really slow, because that's all part of the proprioception. This is why we're bipeds, because they put all of our nerves that tell our body what muscles to engage when we're walking are in our feet and our ankles. That's one of the important parts of being a biped. Slowly moving around. Find that full range of motion. I may come in here, pick one direction first. Think of making those smiley faces, or maybe it was a frowning face. I'm going to hold your leg for you. There. Full range of motion. And now switch directions. Going both directions. Simplest things we do that bring the greatest healing to our body.
It's the awareness of acknowledging how everything works together, and trying to separate them really gives a different awareness.
And then relax that down. All of these tissues can't be separated. They're all connected one to the next. That's really important to remember when you're healing, because we'll get stuck in a back that's uncomfortable, and remember the rest of your lovely body that's connected to that back. So now we're moving into the left knee, and if you're hadn't been using your strap, you might want it. My only requirement with the strap is that I have really long monkey arms, so I can take my hands to the back of the thigh without my shoulders lifting. You want to keep your shoulders on the ground in your neutral position. If you can do that and have the thighs straight up and down, so 90 degrees from the spine, then it's okay. See how your shoulders are lifting though? So I want you to use the strap.
I do not have monkey arms, and I have tight shoulders.
Yeah, so we're already lifting the shoulders, so just relax them. So now you're going to take your thigh bone to 90 degrees. And think of relaxing your ankle and your toes. So initiate. So much of this is this initiating from one area. From your knee, you're going to inhale and reach and extend through the leg. And exhale and drop back down. Yeah, nice. And we go slow, finding that end range of motion. Each time you can add another half an inch in how far you go, right?
No, I feel it pulling on my back when I get out towards.
You do feel pulling in your back? Okay.
When I get out like here, I feel it.
So that's important to
The
know.
last time was tighter than that time, so it's definitely.
So it's loosening as you do it.
Mm-hmm.
So this is really important stuff for you guys to know, and this is what I encourage you to explore, is this is the joyful discomfort I'm talking about. It's not going to be like eating bonbons in bed. There's going to be discomfort in your body when you do these things. But if you can do it to your breath, so your breath isn't getting stuck anywhere. If there's, remember, rigidity in your breath is rigidity in the body. Take breaks when you need to take breaks. But the other thing is, what are you saying to yourself? So he just said to me, the feedback was that the discomfort is lessening every time he goes through it.
Well, and the other thing for me is that I tend to push through it instead of letting it be on its own terms.
Okay.
Like I'll push the stretch to an extra place. Guess what? That's when it hurts my back a little bit. You know? And then if I do it correctly, I get more motion anyway the next time, and there's no pain in my back.
Awesome.
So that's for a lot of people in yoga in general, and I was guilty of it for many years too, and still am. I try to push too far.
Right. And he had a very active yoga practice for many years, so he knows what he's talking about. So the big thing with these movements versus regular yoga, and this does come from the yoga lineage, it comes from the Bihar school of yoga. This is the Pawanmuttasana series was what it's called, and it's supposed to prepare you for a full yoga practice or for whatever you're going to do for that day. But there's a whole energetic component to this. It's not just physical body, it's also opening the energies of each of your joints is a secondary, what we say is a secondary chakra, secondary energy center. So your knees are about your ability to basically be buoyant in life, kind of this idea of being able to bend with the things that are thrown at you. So that's all part of the thing we look at too with these gentle joint motions, and that we're doing them in isolation. That's the big thing. You're isolating the knee. It doesn't mean you're not going to feel it other places in your body, but we're doing these motions in isolation. So now we're going to go back. Well, we've done the legs. I'm going to have them do just a few pelvic tilts before we flip over. We are going to be flipping over today. So going back to what we started with, feet are on the ground, right, ankles underneath the knees in constructive rest. Inhaling, low back lifts. Nope, just the opposite.
Sorry.
That's okay. Inhale, tailbone into the ground, belly lifts. Exhale, pressing low back and low ribs into the floor. There. So we also repeat patterns of movements to see, does it feel more fluid? Is there more or less sensation? Is it the kind of sensation, is it the direction, is the sensation in the direction you want to go? Or, is there a dulling of sensation? Is there more and it's discomfort? So this is our check within ourselves too. Feel okay?
Yeah, and I can definitely push it to a place where it is not comfortable.
Yeah, so we don't want to do that. So because we did the arm thing, now we're going to add what we sometimes call this the flower. We're going to add the arms to this. I'm going to get out of your way. So you're going to continue with pelvic tilting, but this time as you inhale and lift your low back, you're going to turn your arm bones away from your body, so external rotation, and slide them up just as far as they go. Don't push it. There you go. And now as you exhale, press low back, low ribs in the floor, and bring your arm bones all the way in. So internally rotate your arm bones. So that's going to tighten the pectoral area where you're tight, right? We're actually going into that tightness. Inhale, stretch the pectoral area. So whole front body is expanded. Back body is in that arch. Exhale, take the back body out of the arch and contract the front body.
Yeah, that's nice. Feels much more complete.
So this is that full arch and curl. Before we were just doing it for the pelvis. Now it's full arch and curl through the whole length of the spine. Let your head and neck respond. So you can even, Michael, what I'll encourage you to do is you're just sort of letting go on the exhalation. I actually want you to squeeze your arm bones in, feel your upper back stretch, and engage your pectoral muscles beyond. So we have tightness. So when we have tightness in an area, particularly pectoral muscles, what we'll sometimes do, let me get out of your way, is purposely go beyond that tightness. So there's your inhale, stretching them. But now I want you to exhale. Imagine bringing the front of your head of your arm bones towards one another. There you go. Feel that?
No, yeah.
Yeah, tighten it. And then inhale, release it. So sometimes the way to get the muscles that are stuck out of that stuck pattern is to actually tighten them more than where they were initially.
My back out all the time. Oops.
That's okay. Let's do about 1 or 2 more rounds. So if you're at home, you're just feeling yourself inhaling, open the front body, feel that slight contraction through the back body, exhalation, front body's contracted, back body's spacious and long. And you can stop anywhere if you want to hold. So feeling the wholeness of the movement. Nice. And then relax. Do whatever you need to do. Bring your legs into your body. So one of the things I know when I worked with him last week, we were not able to go onto our belly to do any sort of back bends. He was not ready for that. We are now, so we're going to do that today. We're going to finish off with some back bends today. We are. You do all the work. I just chat. Okay, so if you're at home, we're going to roll onto our front side. I got to do a time check. Perfect. I started late.
Oh,
So,
just out of crack.
okay, so this is where I'm going to do a little propping again. So the first thing is when you come down, you can either cross opposite hand to elbow, or you can take your arms into more of a diamond shape or goalpost. What you want to do is come into the position where your shoulders and arms are most relaxed. What I like to do, take your knees, bend them, take your heels up towards the sky, and just gently rock your thigh bones into the earth. So just think of rocking your legs side to side even. You can take the heels up and see if you can release. So he's got a pretty big arch. There's a lot of tightness here. So he's got more of an arch in his low back. And what I'm trying to encourage him to do is release the front of the pelvis and the front of the hips to the ground more. There. Just by gently rocking back and forth. You could also keep your feet on the ground and do the same thing. Just jelly roll the legs or shift the hips side to side. So I also happen to know, and you may have this at home, that for you to be on the tops of your feet is not comfortable. So if you can come, we need to be able to be on the tops of our feet. And for him, that's pulling on your back, right?
Yeah.
If you remember when we were doing our foot movements, it's basically asking our foot to stay in this, our ankle to stay in this extension. So what we do is take a towel. If you've got somebody with you today, you can have them do it for you. Otherwise, we take a towel. You might have a bigger, thicker towel. You're going to roll it up. And yes,
towel person.
At the studio, I have all kinds of fancy props. But you don't need those. You can use a towel, and you're going to put it right underneath the ankles. Is that about the right spot?
Yes.
Is that high enough? Yeah?
A little higher.
A little higher. Further down your feet. Right there?
Yeah.
Okay.
Thank you.
And then shake out a little bit again. So what we're going to do now is we're going to encourage us to truly use the spinal muscles. So all of the little spinal muscles up and down the spine. We want to relax the muscles in the legs and the arms. So think, if you feel your glutes tightening, we don't need that. Hamstrings we don't want to tighten. We want to keep the arms relaxed.
Can I go to my chin?
Yes, you can rest on either your chin or your forehead. So the first thing I'm noting with him is there's a lot of tightness from the top of the shoulder to his ear. So I'm just going to ask, if I have you, and you can try this at home, slide your arm down a little bit more. Is that more relaxing for your shoulder?
Yeah.
Okay, so that's a very simple positioning thing. All I had him do is bring his arms down more so that there's more sense of comfort through the shoulders. And then we're going to change the breathing where we're breathing into our belly. Let me move that out of the way.
No, that's okay.
It becomes really important to breathe into the chest. So notice where your body, the front of the rib cage, is resting on the ground. And see if you can initiate your breath from that frontal rib cage area. So that's right where your diaphragm is. So we're breathing into not the abdominal cavity, but the chest cavity, the thoracic cavity. Think of your lungs, the lower lobes of the lungs at the bottoms of the ribs, middle lobes of the lungs right at the centers of the ribs, and all the way under the collarbones. Yeah, shake it out a little bit.
Again, I'm tightening.
Okay. So breathing into the chest cavity is really important for back bends because it's going to be an upward lift, but there's also an outward. We want to extend. What's going on?
I was just getting a little cramp up my inside of my shoulder blade on the left side.
Okay. So reposition arms wherever you need to. And we're going to start to move. So now as you're taking that breath in, I call these baby cobra poses, you're going to feel yourself breathe in and feel your spine as if it's going, so the crown of the head's like it's going forward. You're lengthening outward and then lifting. Let the breath bring your sternum upward just slightly. You're going to lift your head the littlest bit. Then you're going to exhale and turn onto one cheek. And then completely relax again. Take a couple rounds of breath if you don't completely relax. And then when you're ready, let the breath initiate this movement. Breathe into your chest. Imagine a buoyancy in your breath that's going to float you up. So it's not a force up, it's a float up, and then float back down really slowly with your breath. You can take a full round to relax again. Nice. Floating in the most peculiar way. Lifting up, and then coming back down. So super simple, gentle back bends. So typically if I work with a client who has back pain and I say we're going to do back bends, it's like, whoa, I'm walking out of here, right? And then you explain to them that if the problem is anything in the discs, by doing back bends, first of all, you're strengthening your back line, which tends to be, does anybody sit like this? Because that's a weak back line, right? So it tends to be weak in the first place, but when you're lifting into the back bend, you're actually making space in the discs in the front of the spine. So it's really counters what we think, which is we shouldn't do a back bend when we have back pain. It's quite the opposite. We're going to do back bending before we do forward folding and rounding. So lifting up on the inhale, floating up, and exhaling down. And you're just checking too, because what we want to watch, so if we have any of those gripper muscles and the low back, and in your case, I know, and for some of you, yeah, you can take the arms down there. If the gripper muscles are around the sacrum on either side of the butt cheeks, you're trying to keep those quiet as you're lifting through your spine. Does that make sense?
Absolutely.
Yeah. And now he took his arms to the sides, more comfort. So what you can work on doing is as you're lifting, lift the head of the arm bone slightly off the floor. There you go. But you're reaching forward and then coming back down. So that's true spinal extension. Letting the muscles in the legs stay relaxed and the arms. Using your spinal muscles.
Yeah, it really feels different energy from the chest.
Yeah. And the breath is the key element here. It's lifting you up. So the breath in is the levity. I always say that's your levity you're lifting. The breath out is gravity, just slowly dropping down. And letting that head, and yep, if you start to feel any tightening through the legs, through the buttocks, the low back, or the sacral area, just shake the legs out. You can even take your feet up towards the sky again, rock them side to side. Yeah. So trying to program the spinal muscles to engage on the inhale and release on the exhale. That's it. You feel like you want to do one or two more and then we'll finish up? Looking at the time. And you can experiment with different arm positions.
Seems like it's best when they like
Best
this.
there? All right. And remember the outward first. You're lengthening. Think of making space between the discs and then lifting up from the chest cavity, from your collarbones. Your collarbones smile as you come up and then release back down. Nice. Last one.
I've never had my collarbone smile, I don't think.
I like smiling collarbones. Good?
Mm-hmm.
All right. So for some people, a child's pose might feel really good. That would be the counter pose to back bends because you're taking your spine into flexion. But the word of warning with that is when you have a back injury, that may not be the answer. If it is your discs, that's not where you want to go. You go back on your backside and hug your knees into your chest rather than doing a child's pose.
I know this feels good. So
Okay, so you know, because his is actually more sacral area than lumbar spine. So typically with that, you can take it back. But you may want to flip onto your backside and you can flip onto so child's pose on your backside is just this, right? It's the same position, but instead of lifting the low back and rounding the low back and tightening the front of the discs, you can leave the low back long and hug the knees in.
it actually feels like the arm stretches with
Yeah, you get a lot of
releases
tightness.
the tightness on my sacrum.
That's something to explore in another session, because I think there's a lot of truth to that.
Right now I have a fantastic hairdo as well.
Would you like to come on your backside? Relaxation? Sure. Okay. So make your way on your backside. We're finishing up our yoga therapy session. Thanks you guys for watching. So, that's okay. So probably more than likely at this point it's going to be more comfortable to extend your legs. I am, you know what, I'll pull this in. Oh, this one, here we go. I would not allow him to extend his legs without something under the knees, and I don't care if he tells me what he tells me. I want something under your knees. So there. Sometimes I have to make the call. But again, it's about as you start to walk your feet out to extend your legs, if it changes the shape of your low back, then you know you want something underneath your knees. And just shake the legs out. Take your arms wherever it's most comfortable for you. You can gently move your head from side to side. So one of the things I find with, and yes, I do have quite a few back problems, my sacrum, and it was really aggravated yesterday. So what I find is to remember when there's pain in one part of the body, remember the whole. Remember that there's not pain in the whole. And as you come into Shavasana, you can close your eyes and feel yourself from the toes to the head and the fingers into the heart. And from your skin in is your territory and your territory alone. Nobody else can feel it. Nobody else can be in there. And it's your felt sense space. And instead of just feeling what is uncomfortable or even painful, notice where there's no sensation in your body. Or maybe notice where the places in your body that feel light and relaxed. So go back into descriptive words. If you were describing to yourself what you feel inside of your body, writing a short poetic piece of what you feel inside, what words come up? And there might be some words of nastiness or discomfort, but also the words of peace and relaxation and spaciousness, freedom.
Love, ease.
Love and
joy,
ease.
Glory in my own body.
Notice how your body starts to breathe you. So are you still chest breathing? And maybe that's because your body needs that chest breath. You may have opened new spaces, both physically and pranically speaking, that your breath is being directed into your chest.
What she said.
Yeah, saw that. But it also may be a case where you're back to your belly breathing because that you're sensing that relaxation in the low back. So at this point, you're no longer controlling or manipulating your breath in any way. The breath is breathing you, and it knows what's best for you.
Well, we're working on the lower part of my body, but my shoulders are looser, way looser than they were when we started.
Your shoulders look like they're almost an inch closer to the ground than they were when we started.
I can totally feel it.
Yeah. And a lot of times what's more important than what I see is what your feedback is, right? So even if I barely saw or didn't see any detectable difference between where your shoulders are in relation to the floor, he's feeling his shoulders more relaxed, right? That's what we look at. What does it feel like? That felt sense is so important. I was just rereading a book that I love, and it explains where the placebo effect came from in the first study that used the placebo effect and how real that is. You know, people will knock it and say that's a bunch of hogwash, but if you believe that you're healing, that you're getting better, that you're relaxed, that you're peaceful, that's very different than believing that you're going further into a pain cycle or into discomfort, that you're anxious, that you're uneasy. So placebo effect is super powerful. So what can you say to yourself right now to help yourself heal and relax? And when you're ready to come out, you're going to want to roll to one side first. So you can choose right or left, whichever side you're going to. If you're going to your left, take your left arm overhead, use that as a pillow. If you're going to your right, use your right arm as a pillow. Slowly roll to one side. Take this out. I can sit on it. Pause there. Even in this fetal curl, which is really the life-sustaining posture, right? We all started out in this posture. There's that room for just gentle undulations or movements through the spine. Yes. And when you're ready to come up, you use the strength of your arms, pressing your arms into the ground and walking yourself back up. You got some curly hair going. All right. Thank you for being here. Whoever's with us, thank you for sticking with it, even though we had some there. Sunday morning from here. Time. Peace, joy, love, and light.
Thank you.
Namaste.